Welcome to another episode of the HealthCast. My name is Phil Zappone. We are happy to have Dr. Zaman Shah today with us, an internal medicine and primary care doc and the CEO and founder of Medway AI. Welcome, Zaman.
Thank you, Phil. Thanks for the opportunity for having me here.
Okay. How about we just dive right into it? Tell me how you, maybe a little bit of your journey as a physician and how you came to found Medway AI.
Yeah, I've been a physician for nearly 15 years now. And I think right after I finished my formal training and started work in a hospital, quickly realized that most of the time I had was spent in front of the computer doing documentation, compliance tasks, and administrative tasks, rather than being in front of the physician and interacting with them. And that was really that spark that really led to the formation of Medway eventually, because I really wanted for technology to take care of that redundant, unintellectual, repetitive tasks, allowing physicians to be more engaged, present, and more informed, about their patients. And that's really, how it came into being.
Yeah, I like that. And you founded it in 2023, is that right?
That is correct. Formally incorporated in 24, but yes, we started working on it 2023. Yes.
And so I was poking around on your website. It looked great. And I saw that, the focus, I thought a broad focus, both on improving patient care, improving clinician workload. And I think like just making a healthcare system as a whole a little more, less burdensome and a little more streamlined. Is that about?
Absolutely. Like we call it a better way for healthcare, So really what we are trying to do is, of course, a lot of that time that I mentioned, most of physicians' time is spent in front of the computer doing other tasks rather than engaging with the patient. That really leads to disengaged encounters, loss of trust in the process. Physicians are burnt out and frustrated because that's not the part of work they signed up for. They really wanted to be with their patients, solving problems, taking care of things. And so the way we approach it is, if we are able to automate the workflow or most of the items in the workflow of a physician, that really allows them time to be better connected with their patients, to be more informed about their patients, and at the same time have time for themselves and have a life of their own as well.
Of course. Yeah. Yeah. As I've been doing these podcasts and meeting interesting people like yourself, I've been pleased to learn that I'm sensing there's still this focus on improved patient outcomes, and that AI is this amazing tool. It can be helpful, but it's still about human contact. And in my own clinical practice, I'm realizing I've been in practice almost 10 years, but still feel like I'm learning every day, and just trust. I have a lot of turnover where I work, being in rural medicine, small town, and they want a familiar face. They want to be able to come to you. And as much as I'm using some tools, it's still that trust, I think, is a word that I keep bumping up against.
Right. So I think the important thing there is, when you think of the technology as something that is an invisible layer working in the background, allowing you to be more present and connected with your patient, they actually love it a lot more. Personally, in my practice, I see it as if it's something, let's say if I'm using an AI scribe, for example, it sits in the background, listens to the conversation, allowing me to, instead of, spending that time in front of the computer typing my note, I'm actually more engaged with the patient, talking to them, answering their questions. And at the same time, I'm more confident that when I'm done, my note is done as well. So that saves me time. More importantly, though, because we know this technology, listens to the conversation in the background, I do a better job explaining things to my patient, because in the process, it gets to the AI as well, and it listens and does a better job at creating a note. So it allows me an opportunity to be present in that conversation, to do a better job explaining things, answering questions, a much elevated care experience, I would say, on both ends.
Yeah, I like that. Elevated care experience. I like that a lot. So on Medway, is there 4 components or 4 tasks that are broken down with names? Help me out when I saw
Yeah, I think I'd keep it a little simple, because, there's a lot of revisions and iterations. The website is sometimes behind your progress. So it's with us as well. And there's going to be, hopefully in the next week or two, another, revamp of our website. But really, we look at the clinician workflow we look at it in 3 boxes, I would say. And Like the first step in the process is when you're seeing a patient, you need access to their information. You need to know what they were seen here before for, what medicines they take, what allergies they have, what imaging they've done, testing, anything. You referred them somewhere. And so you go to the EHR and you spend time digging for that information before you even get in front of them. Or sometimes even during the encounter, you have to go to the EHR to try to find out what's happening. So we have incorporated a conversational interface, a chat interface where you just ask and that information is delivered. And really in a very visually informative way. So for example, you have a diabetic patient and you want to see how their diabetes control has been. Instead of making like 100 clicks to find different data points, you say, how's their diabetes control? And in one flash, it just gives you a plot where their last 5 A1Cs are plotted on the chart. And so in one instant, you can tell whether it's been controlled, whether it's been going bad, getting worse, getting better, whatever the case may be. So that's the first part, that it better prepares you and informs you about your patient. The second part is actually the order entry part. That's the process, that we're building presently. So when you say, you are going to order amoxicillin for somebody's sore throat, you don't have to go into the EHR and go to select their pharmacy and plug in medication. You just say that during the conversation. It captures it from within that ambient, and really goes and checks for allergies, goes and checks for interactions, and then puts it in the right fields for you to quickly review and submit with one click. So that's the second part. The third part is closing the loop of the physician workflow is the documentation part. So obviously when we're done with the patient, we have to sit back and, write a note. And that's the part that is done, taken care of by the AI scribe part. So we have these three parts, I would say. There's additional things we have in the pipeline that we are working on. But presently, the three things we're focused on are the chat, the orders, and the scribe. And those are the three essential components there.
So when you say you can access, say, like historical records, or is that, what about somebody who maybe, say, is on a road trip passing through Alabama, and like if they haven't visited your EHR, is it only in your EHR? Does it branch beyond?
That's a great question. Yes. So the goal really is what we're working towards it. It's not just the EHR itself. We're actually becoming part of a nationwide health information exchange called TEFCA. So TEFCA is a nationwide network, and we are getting incorporated or connecting, integrating with one of the QHINs, so health information networks. And from there, you will actually have access to your patient's data from elsewhere as well, which is going to be amazing, especially in situations where you're seeing the patient the first time, or they traveled recently, or in EHR settings and stuff like that. Yes.
That's cool. I'm going to have to look into that more. I live in, my community has a tourist-based economy. So we live in the mountains, and that sounds like a very helpful tool.
Absolutely. I mean, like right now, especially if you look at when you see a patient and you send them to, let's say, a specialist, an oncologist, then they come back and they don't know anything, about what happened. You have to formally, have them sign a release form. You have to fax that request. Then in another week or two, you will get the records. Then they get scanned into the system. Think of that process going into a matter of seconds, number one. And number two, what's even more important is not that when you need a record that you get 300 pages of information and you have to sift through all of that to find what you need. If you are asking and exactly getting in return the question that you asked, I mean, that could be life-changing for us, really.
That sounds amazing. Tell me about some of the successes and some of the, as well as some of the challenges that you faced with Medway.
All right. So I guess the first, when we initially started, our approach was more directly kind of a standalone solution, directly addressing physicians. But we quickly realized the true value is in integrated solutions. I mean, it's not going to work if it's a standalone solution. In fact, it really creates more friction and wastes more time rather than gaining if you have your EHR opened up in one window and then Medway or any other solution for that matter open in another, and you go back and forth and do copy paste thing. I think that's not going to work. So the way we realized that the true value is actually in deep integration within the EHR, where it's a native environment for the physician. They don't have to go elsewhere. They're in their EHR. It's under their brand. And that's the approach we have taken now. So we really partner up with EHRs And we specifically provide them the AI infrastructure they need to provide these essential AI features to their users. And really, our point there is that we are a plug and play solution. So it's a quick time to value for the EHR. So it's a win-win for everybody. I mean, like the end user, the clinician, which is our primary target, they get the value within their EHR system, deeply integrated, so they can get access to all data points, do write back and do documentation, everything. At the same time, it allows us a better distribution system because EHR already has that established contact with their users. We just provide the backend infrastructure. And when the solution is ready, the EHRs usually take care of the distribution part. So, I mean, it works really well in terms of the go-to-market strategy. And at the same time, it's better value for the end users as well.
What are some challenges that you've faced or overcome over the years?
I think the biggest challenge is really the integration part, especially, there's like nearly 600 EHRs that exist in the US market alone.
Um,
And each one of them have a different system altogether, and some of them have publicly available APIs and systems for integration, but those are usually the systems that do all of that on their own. Like, for example, Epic and Cerner, they have bold vision for AI and they're going to take care of it. We are focused on a market that is very niche in terms of small to mid-size specialty specific EHRs where they don't have the time, capacity, or resources to build AI from ground up. So we really provide them that backbone that they need to get to market quickly, have the essential AI components for their users, and at the same time, it's under their own brand. So we're just kind of like a white label solution in the background. Now, the challenging part there is, just like I mentioned, is because each one of these EHRs is different. So even though our plug and play solution, we optimize our development kit and UI elements and everything after each of these integrations, there's still about a third of the part at least, when we do the plug and play, that we have to sit with the EHR to address their unique situation, to see how they share or consume, any technology inputs. At the same time, what the unique needs are for their user population, and then tweak it accordingly to make sure it best suits their users on that end.
yeah. What is the customer demographic for Medway? Is it clinics? Or is the EHRs themselves or?
So right now, even though we are available on some marketplaces, for example, Athena Marketplace, where we are directly facing, the physicians, we are focused mostly on ambulatory care settings. So, whether it's a solo physician or clinician versus a multi-specialty group practice, that's generally our go-to-market to begin with. But at the same time, like I said, the best model that we have been adopting and growing in is really directly partnering with the EHR. So our customer, in essence, become the EHR who actually delivers it to their clinician users. And we already built like a co-developed with an ambulatory EHR system. We actually signed, in fact, we just went live with them like a week ago to their users. So we're pretty excited about that progress. The second is we actually signed up another specialty specific EHR that we're going to, co-build with. We've started the process, so hopefully will be done over the next 6 to 8 weeks. And then we went live on Athena Marketplace. So there's a lot of momentum there. There's a lot to.
Yeah, Zaman.
Of course,
Cool.
we want to partner up with more and more EHRs because the technology is amazing. I mean, I've seen it and used it firsthand every single day in my practice, seeing how much time it saves for me, seeing how capable it makes me to be more connected and engaged with my patients, provide better care, more informed care. And that's what I want to or intend to provide to every clinician out there.
That sounds great. And when you say a specialty group, are we saying like a cardiology group, maybe a gastroenterology group, maybe urgent care? Are you like kind of these niche?
Specialty, it's actually like, the entire spectrum. Like, for example, one of the EHRs that we started co-building with, it's actually ophthalmology and optometry specific. So, behavioral health care, ambulatory care, of course, all of the clinical specialties that we're talking about. So we're exploring like urology and orthopedics market and stuff like that. So it's really, the entire spectrum, because the technology has the potential to increase productivity, increase ROI for clinicians and practices, at the same time provide better care and more time for the, for the clinician. So it really has the potential. We just need to find the right distribution channel, the right way to partner up with EHRs to deliver it there.
You touched on this a little bit with the recent growth that you mentioned. Congratulations there. But I was going to ask, how does the future look for Medway?
Amazing. I would say I'm super excited about the momentum and everything we're having and happening right now. Obviously, with all of this comes a lot of responsibility to make sure anything we're doing is safe, is secure, is compliant. At the same time, it's scalable as well. So of course, we, with all of this momentum, we of course are getting to a point where we need more resources to keep up with that momentum, to grow and scale as we want to. And this is really that point where we are actually in the market for a seed raise as well. So, startup has just entered into our seed round. We're having early conversations with the investors with this amazing opportunity and momentum there.
That's very cool. That's very cool. If you could either, if you had one thing you could change, either increase revenue, decrease time, or decrease costs, what would you prioritize?
So I think, interestingly, that's the amazing piece of this, that these things are not mutually exclusive. Up until now, we were thinking like, if you have a better care experience or if you have to save time, you actually have to spend more money. On the contrary, it is actually, with this AI technology, it allows you to have more time. It allows you to provide better, more elevated care and care experience at the same time, while making you more productive. Like if it gives me like just some early data that we're seeing about 30% increased productivity for clinicians using our technology. So, I mean, instead of you seeing, let's say, X number of patients, now you're seeing 30% more. So it really transforms into more revenue. At the same time, your patients are happy and you're happy, because the part of your work that was annoying you is now being done by technology, enabling you to just be present in the conversation, be more informed and engaged, and be present for the people who need you at that time.
Yeah, yeah. So improved. There was two things that you said that resonated with me. You said, I think, you said improve productivity 30%, improve patient outcomes, or at least improve patient rapport, and potentially improve patient outcomes because the clinician is more present.
More present is one thing. And with the chat technology, like, for example, if I would just say a hypothetical example, a physician who has to go to a patient's room to start the conversation, generally, because of the lack of time, you just want to hit on the important points, make sure you have a little context before you go into that room and start the conversation. Now that you know that everything is just the one question away from you, you just ask, like, what happened when they went to their cardiologist? When was their last echo done? What did it show? And so you have so much more context and information about your patient when you go to that room and start talking to them. Your decisions are much more informed and data driven. That definitely translates into better care quality at the same time. Yes.
That's wild. And I'm just thinking to myself in a patient room, is this similar to when I use my phone with Siri? Is it voice?
It's voice. It's voice and text chat, what you prefer to do. And it can respond back. When it responds back, it spurts out the data in multiple different formats, depending on what it seems to be the best fit. Just like I told you, a line chart, it can give you a table, it can give you a list, it can give you a structured text. You can have a conversation back and forth with it. So yeah, it is truly wild. Yes.
Yeah, that sounds amazing. And this might be a little redundant, but I'm just for my own understanding. So at the end of our conversation, maybe I'm talking to my colleagues. It's not individual clinicians that would reach out to Medway. It would even if I went to my manager, it wouldn't be the clinic. We work with Cerner. It would potentially be, hey Cerner, like, this is a cool tool we wouldn't mind using, and maybe having Cerner reach out to Medway. Is that how that would transpire?
Absolutely. So for Cerner or Epic, they have marketplaces, and we can actually have our app deployed on marketplaces. I mean, I don't know if this is the best thing, but what we tried to do was, because Cerner and Epic have all the resources in the world, that they can spend on building their own technology. We focused primarily on smaller EHRs, mid-sized EHRs. They don't have that technology to do that. But certainly, like it obviously it's an amazing technology and everybody can benefit from it. And that's why I'm saying we're trying to increase our resources so that we're able to be available on all of these marketplaces. And that way you wouldn't have to go to Cerner. You would just have an app on the Cerner marketplace and you just download that app and it's actually available within your EHR itself. You can do all of the functionalities that you would otherwise. It'll be deeply integrated with Cerner automatically.
It is presently or in the future?
No, so it is integrated with Cerner. We haven't deployed an app on the marketplace. I mean, it gives me a good idea that maybe we need to do that. We thought Cerner already have amazing stuff in their EHRs and people may not necessarily require this, but it seems like, what we have to offer transcends beyond just like small to mid-sized company. I mean, it is essential AI, but at the same time, it's revolutionary as to what it makes you capable of. It makes me think as soon as we have the resources we need to be on the marketplaces for Cerner and Epic as well, for sure.
Yeah. So some of my colleagues pay on their own. We have a company AI device just for documentation, and some colleagues use similar. If they don't like that one, I know a couple of our docs pay for one out of their pocket that does something different and so forth. But Medway is not something that I, as an individual, I could just go sign up for.
You have a standalone product that you can sign up for and start using that tomorrow. The only problem is that in that case, you get access to the scribe alone. The reason is because like in order to talk to data, you have to be integrated with the EHR. In order to write back to your EHR, like prescriptions or orders or something, you have to be integrated. So the integrated solution actually provides a much better value and a more comprehensive depth than just the AI scribe. That happens, when it's integrated. But yes, like, just for the scribe alone, that would be available like right now, yeah, to everyone.
Yeah. Tell me the reach of your company. Are you just in your regional area, or at least in terms of the United States or across the globe? Tell me the Medway's reach.
US market overall. So, our initial customers are not necessarily very regional because when we go through EHR usually has customer all across the nation, and that automatically kind of spreads us all over the place. The ambulatory EHR that we have integrated with and went live with, they are, more focused in the South and Midwest area. So this is where we have started with, but obviously, as we partner up with more EHRs, for example, like being on Athena Marketplace really, exposes us to the entire US market. Being integrated with Cerner and Epic really exposes us to everybody. We need to have apps on those marketplaces for that purpose. But yes, we are in the whole US market to be available.
Is there a number of, say, how many providers are currently using Medway, or something we get our heads around? We can get our head around in terms of the reach, and how many docs are taking advantage, or clinicians are taking advantage of Medway?
For us, there's a lot of upfront work involved when we are integrated with the EHR. So like think of you have no users, and all of a sudden when you're live with the EHR, you go into hundreds and potentially thousands of users right away. So presently, we are, like in double-digit numbers, close to 100. But just like as we went live with the EHR, that's going to expose us to, thousands of physicians over the next 2-3 months. And then, of course, the next EHR that we have signed that takes that number further. And of course, going live on Athena, really, they have a huge market. Being there, it's going to quickly, improve our user base there.
I think you said it. Now I understand you guys are on the cusp of your growth being exponential here.
Exactly. So I think we're at a serious inflection point, I would say, because up until now, our focus was more product heavy, getting everything built to be ready for that physician experience, even though, of course, we have users presently. But going live on these 2-3 platforms, that really exposes us to everybody. And that's really going to drive our revenue for us as well.
That's exciting. What are some trends that you're seeing on the horizon, both as AI and healthcare as a whole, and maybe for Medway specifically?
I think the 2-3 things I see is, firstly, AI has a major role to play down the line, in terms of automating a lot of these redundant tasks in healthcare that could be on multiple levels, that could be around the clinician workflow, that could be more along the lines of operations. Any and all of those things are going to see serious automation and optimization workflows down the line. The second part is, even though some people think of AI more as a replacement for clinicians and physicians, I personally think of it more as an enabling technology. So it really works silently in the background. That's how I see AI playing a role, because you can never replace the empathy, the trust, the helping hand of the physician and the clinician in the room. You can never do that. And so having an approach where you think of AI more as an enabler, to do all of those redundant tasks, making the physician and the clinician more capable of their task, making them more efficient, making them more informed, is the way technology is going to evolve. And then I think the other thing, thankfully, that's happening is on the receiving side. Like, healthcare has long been due for a serious overhaul, and I think we're all excited and ready for it. Whether it's clinics or hospital systems, or everybody's ready to embrace the technology to do that. Now, of course, this brings a serious responsibility as well on all of us, that any technology that we build and develop and scale is truly secure, and compliant with the best standards, out there. So, of course, that's how it's going to evolve and play out. But I see that in the next 2-3 years, or 2 to 5, I would say it's going to be a huge change in the way healthcare is delivered in the US market.
I like that. I like the way you explain that, and it's also reassuring. I keep hearing from people who have a better grasp than me, the people that I interview, whether it's entrepreneurs, docs, or whomever, that it's an amazing tool, but we still, that the human element cannot be removed. It's to make things more efficient, but it's still about relationships. It's still about humans, and that's what I'm hearing from you as well.
It is about restoring the human connection, not replacing that. That's really the key here.
That's reassuring. Yeah, that's fantastic. Well, thanks so much for being with us today, Dr. Shah. Really appreciate your time. I think our listeners will really appreciate this information, and thank you for taking time for your day to speak with me.
Thank you, Phil. It was great to speak to you. Thanks for the opportunity.
Okay. Thanks so much for listening to another episode of the Healthcast. If you guys have any questions, feel free to message. Feel free to check out Medway AI and what they're up to on their website. Anywhere else where you would direct people interested in learning more about your products?
We're going to have I think in another week or so, the website will explain a lot more in a much simpler way, where everybody can understand what the technology is capable of and how to get a hold of it, and how to get in touch. So it'll be a much more elaborative website in another, allow me just another week or two on that. So.
Sure. They'll check it out. Okay. All right. Well, that's a wrap for today. Thanks again. And stay tuned for the next episode of the Healthcast.